All right, so we're back at SWAPA for day 2. Dr. Canipe from the Chicago School, and this is Bree. I'll let her go ahead and introduce herself and tell us a little bit about her study.
Yeah, absolutely. So I'm Bryanna. I'm a third-year doctoral student here. So my study is looking at ADHD symptoms across the menstrual cycle. So there's really not a lot of research on the different presentations of ADHD symptoms between men and women, and they often present differently. Males often have more external symptoms, so they exhibit a lot of more impulsive, hyperactive symptoms, while females exhibit more inattentive, which are more internalized. And they also have a higher comorbidity rate for other disorders like anxiety, depression. So it can lead to misdiagnosis, underdiagnosis, late diagnosis, all of the fun things.
So as a clinical student, right, like we're taking a lot of these things from the clinical perspective.
Yeah.
Research on this, as you said, is very limited.
Yeah.
Like if you could give the big take-home message of what we're hoping to get out of this study, what would you say that is?
Yeah, I think just understanding how ADHD symptoms could potentially even present differently, but also present differently throughout like the 20-day cycle. So like if they have worse symptoms like 2 weeks before their menstruation starts, they can maybe up their medication or get more behavioral treatments to kind of help them with that, so that they don't have to experience an increase in symptoms and then they're like, I don't know what's happening, right?
So, I mean, this is very patient focused, but this is also really important for clinicians to know as well, right?
Absolutely.
If they can kind of ask that as part of their, hey, how are you doing at the beginning of an appointment, and kind of knowing that piece of information, it seems like it would be that certain types of interventions would work better at certain times and with different things, especially when you go like different medications and things like that, right?
Yeah, absolutely. I've started to like incorporate this with my own clients of like, I ask them, I'm like, where are you like in your cycle? Because sometimes they come in and they're like, hey, I'm brain fog, I can't do anything. And I'm like, well, what's going on? So it's just like, even just like understanding the fluctuations between these things can even just help them of like, oh, well, like I'm not like crazy, right? There are like some actual things happening.
Absolutely. So if there's like one thing that you wish the clinical community could know about ADHD and women in particular, like what would you tell all of us?
I think we just have to ask more questions, right? I really think we do. I think we just kind of go, cool, you have ADHD, we slap it on, and then we kind of sometimes move on from it. But understanding how they, like, it doesn't just stay stable, like, oh, you have ADHD symptoms, like executive functions, working memory, it just all stays the same. It's like, you can be fine and stable at some point, but also it can get worse at other points, right? And like being able to address that, recognize it, address it, and then be able to treat that could significantly help and increase functioning within individuals. So
it sounds like we need to remember that individualized approaches are really helpful, and maybe an individualized approach per appointment at different points in time really matter, even for the same person.
Yeah, absolutely, 100%.
Well, so something unrelated to your study, you're a third-year graduate student, headed towards your like clinical competencies and all of that. You'll be headed on internship really soon. So what piece of advice would you have for anybody that might be watching this about graduate school?
Time management, get that down. If you don't, you'll be forced to get it down. Also figure out your why. Why?
Your why?
Why do you want to do this, right? It gets hard sometimes. You have to have your why, and it helps you get out of your burnout. It will happen, but knowing why you're doing this and having your reason, I think is super important and helpful to push through the really difficult times that will happen.
If you were given the opportunity to do it all over again, would you still do it?
Maybe, yeah.
Great. Thanks, Bree.
Absolutely.